Assalamu alaikum, Dr. Reshma Sharmin here, senior consultant. Here we are showing a case of laparoscopic tubal recanalization. So first we have done the adhesiolysis of the sigmoid colon, that's due to congenital adhesion and due to previous history of the caesarean section. After that, we have tried to evaluate the anatomy, especially the condition of the tubal anatomy, as she has history of tubal ligation during her C-section. So what we have observed that the medial part of the tube, I mean the cornual part of the tube, seems little bit shorter. So what we have decided that in this side we have to cut the mesosalpinx little bit longer so that we can done the recanalization nicely. So we have injected the vasopressin at the mesosalpinx in a view to reduce the blood loss. Then we have freshened the edge of the tube, both the cornual part and the distal part, by cutting small part of the tube. After that, we have tested the patency of the cornual part of the tube. So the same procedure we have done on the opposite side. So opposite side, you can appreciate very nicely that the proximal part seems extremely shortened by previous ligation. So here we have injected the vasopressin in the mesosalpinx so that we can have reduced blood loss during the surgery. So here we can see the proximal part, and now we have checked the patency where it's shown that the cornual part is patent. After that, we are cutting the distal part of the tube to make it freshened, and then the first step of the tubal recanalization is to approximate the mesosalpinx by putting a bite at the level of the 6 o'clock position. Here we have used 5-0-vicryl. 5-0-proline also can be used in this procedure, and ideally it should be done by the laparoscopic 3 mm instrument, 3 mm needle and 3 mm Maryland. But as due to scarcity of the instrument, we have used 5 mm instrument here. So you can appreciate that we have placed 3 bites here, one at the 6 o'clock position, one at the 10 o'clock position, and one at the 2 o'clock position. So if we compare the open procedure of the tubal recanalization with the laparoscopic tubal recanalization, it seems to me that laparoscopic tubal recanalization seems to be little bit easier than the open method. So once we have finished the suturing done, then we have tested the tube where it showed that the tube became patent after doing the dye test. Then we have started doing opposite side, though from my initial prediction, it seems that this part seems to be difficult due to having shortening of the proximal part. However, after completion of the procedure, we felt that the difficult side we have managed nicely, even more better than the opposite side. So here you can appreciate that we are putting a suture at the mesosalpinx just to keep closer of the both tube. So now the proximal part of the tube gets closer with the distal tube. Now the job becomes very easy. Now we are placing a suture with the distal part by seeing the lumen. So here we can exclude the lumen by seeing it by the blessings of having magnified view of the laparoscopy. So we have placed a suture and we very nicely have anastomosed the proximal part with the distal part. So here we are putting a knot at the 2 o'clock position. So just after placing 2 knot, it seems that the tube anastomosis to each other have done. But in spite of that, we have placed the third knot at the distal part of the tube with the proximal part at the 10 o'clock position. So after that, we'll check the patency. So we can appreciate that how we have excluded the lumen. So after laparoscopic tubal recanalization, we have a plan to check the tubal patency by doing saline infusion sonography in our center. Before doing laparoscopic tubal recanalization, it is mandatory to check the ovarian reserve and to check the semen analysis of the partner. If the ovarian reserve seems good and the semen analysis is okay, then we can counsel the lady to do laparoscopic or open tubal recanalization. And also in subsequent pregnancy, it is mandatory to check the location of the pregnancy to exclude ectopic pregnancy. Now we can see that in patency test, it's very nicely showing. It's all for today. Thank you so much for watching.